Welcome to the deep dive. Today, we're plunging into a topic that honestly affects so many people, nearly a billion globally, mental health. And this isn't just about individual struggles, is it? It's this massive burden, really, with huge social, economic consequences for everyone.
Yeah, and the numbers are pretty startling. A 38% jump in people affected between 1990 and 2019. That's significant.
Wow. So today we're looking at it maybe from a slightly different angle.
Exactly. We're exploring something called the commercial determinants of mental health, or CDOMH for short.
Okay, CDOMH.
It's basically the systems, the practices, the ways commercial actors, big companies, influence our mental well-being, often quite subtly.
Powerful stuff, and maybe not always obvious. And a deep dive today, it's based on a really significant piece of research, right? An umbrella review.
That's right, an umbrella review. So it's like a review of other systematic reviews. It pulls together all that high-level evidence.
Synthesizing the syntheses, essentially.
Yeah, pretty much. And this one mapped out what we know, but maybe more importantly, what we don't know about population-level interventions. So not individual therapy, but bigger policy changes.
Things like laws, regulations.
Exactly. Changes affecting large groups. Our mission today is really to pull out the key insights and, importantly, spot those surprising gaps in what we know about improving public mental health on a large scale.
Okay, so let's unpack it. What did the review actually find? What do we know?
Well, there is some clear evidence, though maybe less than you'd expect. It seems reducing the availability of certain products can definitely impact mental health outcomes, specifically suicide rates.
Okay, so tangible links were found there. Can you give some examples? Where did interventions seem to work?
Yeah, absolutely. So take alcohol. Things like raising the minimum legal drinking age or reducing the hours stores can sell alcohol, even just increasing the price through taxes.
Right.
Those actions have been linked pretty clearly with a decrease in suicide rates.
So that's quite direct. Policy changes impacting availability or cost, leading to fewer suicides.
Directly. It shows that, commercial policy levers could be public mental health levers.
And it wasn't just alcohol, was it?
No, that's right. Very similar findings for pesticides, implementing national bans on the really highly hazardous types, that appeared effective.
Okay.
It seemed to reduce both suicides using pesticides and overall suicide rates in those areas. So again, clear links in specific cases.
Okay, so we know some things work, alcohol, pesticides, but what about the flip side? The gaps you mentioned, where are we missing information?
This is where it gets, well, pretty surprising. We know there are links, or at least strong suggestions of links, between various industries and mental health problems, right?
Sure, like social media and young people.
Exactly. Social media's impact through things like cyberbullying or messed up sleep patterns, or alcohol. We know it affects brain chemistry, neurotransmitters, and can raise depression risk. But despite all that knowledge, this major review found 0 eligible studies looking at the mental health impact of population-level interventions for industries like social media, tobacco, gambling, or ultra-processed foods.
Wait, 0 for tobacco? For social media?
0 eligible studies that met their criteria for population-level interventions and mental health outcomes beyond suicide in some cases. Think about UPFs, those highly processed snacks and drinks everywhere. Nothing.
That is genuinely shocking, given how much a part of daily life those things are.
It's a massive research void, and it's especially concerning for common conditions like depression and anxiety. Most studies the review did find just focus on suicide. These other widespread issues were largely, well, unmeasured in this context.
And the review also looked at who's doing the research, didn't it? Industry influence.
Critically, yes. This was fascinating. For gambling, for example, all the identified reviews had some link to the gambling industry.
All of them.
All of them. And they tended to focus on things like, quote, responsible gambling individual behavior rather than the industry's practices or, how the products themselves are designed.
Which kind of shifts the focus away from broader policy changes.
Precisely. It can steer policy away from those population-wide public health approaches. Now, contrast that with tobacco, where all the reviews were independent, and alcohol, where nearly 80% were independent.
So it really highlights a challenge in getting unbiased data, especially when powerful commercial interests are potentially involved.
Definitely. It's a critical issue.
So if we try and connect this to the bigger picture, understanding these commercial determinants feels pretty essential, right? Mental health issues aren't spread evenly.
Not at all. They're unequally distributed, and these commercial interests, well, They actively shape those inequalities. Think about where unhealthy products are often marketed or sold most heavily.
Right. And yet you're saying public mental health efforts have often kind of missed this angle.
Largely overlook these powerful commercial influences, yeah. And another key point the review highlighted was a real lack of research from low and middle-income countries.
Even though they face huge mental health challenges and often aggressive marketing from these same industries.
Exactly the same challenges, often targeted specifically by unhealthy commodity industries.
Okay, so wrapping this up, what does this deep dive really tell us? What's the key takeaway for you listening?
I think it reveals a pretty stark reality, doesn't it? We're starting to understand how commercial interests shape mental health, but we have a severe lack of evidence on how to intervene effectively at that big population level.
Especially for these huge industries,
Yeah.
social media, gambling, tobacco, UPFs. We just don't have the roadmap yet for large-scale interventions.
We don't. And it raises some really important questions, given that harmful products, harmful retailers, they often cluster in less advantaged neighborhoods,
Layering the risks.
right? Layering risk factors for poor mental health.
Yeah.
And we know consumption is often linked, like drinking and gambling often go together. So are traditional ways of doing research really enough?
Do we need something different, like more complex thinking?
Maybe. Maybe we need to embrace more complex systems thinking to really find the leverage points, the best ways to improve mental health and tackle these inequalities. So the question for you is, what stands out? How do you see our society addressing or maybe overlooking these really powerful commercial forces affecting our collective mental well-being?